I've always liked to talk to people. I've always been curious about people and their lives. And I think a lot of nurses would say, particularly mental health nurses, that what initially sparks them and their interest in mental health nursing is an interest in people.
I chose mental health nursing because it was the branch that most interested me. It's tied into some of the experience that I'd had before, and so prior to coming into mental health nursing, I worked with adults with autistic spectrum conditions, and so I could potentially have gone into learning disability nursing, but actually within mental health nursing you do cover that too. So it's really wide ranging. That's the fantastic thing about it. So you end up essentially doing a bit of social working as well as mental health nursing.
I think it's about really spending that time with people, and I know other types of nursing you'll do that. If you're an adult nurse, you will be engaging and interacting with people, but for me it was that opportunity to build that relationship, whether it be over a short 6-week stay or over a period of years. You really get to develop a relationship with somebody, and it's really based on trust, and it's a privilege, really.
I remember seeing a poster advertising mental health nursing, and it was a broken violin. There was this image on the poster, and that broken, fractured violin was meant to be a picture of what it's like when people are experiencing mental distress. And would I, as a nurse, have the ability to help reconstruct with the person I'm working with this sort of very delicate concept of the mind? And I thought, yeah, there's something here, this hidden world of health that maybe I can play a part in.
It provides that insight for me. Like I said earlier, I came from Nigeria to England, and I had a different understanding, different beliefs and different expectation of mental health condition. So by the time I started work as HCA and then decided to actually get into professional practice of being exposed to professional practice of mental health nursing, that now changed the old perception and belief that I had around mental health. And then I decided I began to appreciate the psychology of how people behave, what the general society expects of one another, and that is what actually brought about the fascination.
I thought I was going to be an adult nurse, a general nurse. That was my intention, and I fairly quickly realised that the bit that I enjoyed most about the job and I found most fulfilling and interesting was understanding people's experiences, so talking to them and understanding what it was like for them to be in hospital and speaking with their families, and really getting to know somebody. And I remember I did a placement in oncology, and where the emphasis very much was on doing just that, and that was the placement I enjoyed most. So I spent more time with people, providing them emotional support, and that was very much expected. So then when I had my first mental health placement, I had a fantastic placement with a community mental health team where our whole time was spent talking to people, understanding their previous life experiences, talking to them about their life now and their difficulties and problems, and working with them to find a way forward, and doing that through communicating. And so immediately I thought, yeah, this is the area of nursing that I want to go into.
We will all experience some difficulties with our mental health, some challenges with our mental health during our lifetime, without doubt. So the ability to empathise and get on board with people and understand where they're coming from. I think if you feel that you're the kind of person who can do that and has a curiosity about people and a desire to really help them, then I think mental health nursing is probably for you.